I'm here with Paul Soloviev. Paul is currently doing some GP training and consulting work. Paul's been in the industry for a very long time, is very experienced in care planning, spent the last 20 years in the industry. So Paul, I just wanted to ask you what some of the major changes have been over the last 20 years in care planning.
I think the major change in care planning, apart from regulatory changes that we've survived, I say survived, the major change is that we have better understanding of the process. We have better understanding of what are we trying to achieve. Mm-hmm. We're trying to, what do we do about conditions? How do we build multidisciplinary teams? I suppose we're in a much better position to do more and develop further.
Yep.
Yes, because of that better understanding.
Yeah. And you obviously work with a lot of businesses and speak to a lot of GPs. What are some of the recurring challenges that are being brought up to do with chronic disease management at the moment?
There are a few challenges there. There are many challenges there, actually. The first challenge is lack of education, lack of understanding. I know that in the previous question said we have much better understanding, mm-hmm. but now I'm talking about broader community, GPs, nurses. There are no formal programs. There are no courses that would deliver appropriate level of education on how to produce care plans, how to arrange chronic disease management process. And this is the major challenge. GPs are afraid to do something wrong. In the end, they still do something wrong because there's no education, there is no information available. Yes, and providing that education in a consistent way would be the answer, and we will advance much further if we have that education.
Yeah. And one of the big topics that's come up tonight a few times is the shift from reactive care to proactive care. And I'm actually really interested in that space, and you had some really good points around it. I'm interested to know if in the clinics that you're working with, if there are some proactive practices that are being implemented in those clinics, and if you still see that that's the way it's going to be in the future, and how that's all going at the moment.
Yes, proactive healthcare is a dream. Is a dream of every person who feels strongly about better public health.
Yeah.
Yes, and I think today in that room we're all united by this idea, this philosophy of betterment of public health. So yes. Implementation of proactive care is a complex process. It requires a lot of education. It requires an admin process to be set properly. So, for example, you will not expect proactive care from the from the GP that sees 6 or 8 patients per hour. Yep. There is simply no time for that.
Correct.
So the process needs to be set that GP can see 4 patients per hour and have time to be proactive.
Yeah.
Yes, and that is connected to level of revenue, because a GP would say, oh well, what am I going to earn if I see 4 patients per hour instead of 8 or 6 or 7 patients per hour? So there are a lot of intertwined issues there that needs to be addressed for proactive care to live, to be implemented and continue.
Yeah.
Yes.
And do you think that digital technologies are going to play a big part in this space, in assisting GPs with their time coordination?
Absolutely. Vital. The role of digital technology and technology that we've seen today is absolutely vital. Because regulatory constraints are strong. There's a it's called red tape, yeah?
Yeah.
Yes, so a lot of time is spent on paperwork. I'm not saying that paperwork shouldn't be there, and when I say paperwork, I mean the documents.
Yeah.
Yes, the documents should be there, they're appropriate, needs to be done.
Mm-hmm.
The question is how they're being done.
Yeah.
Are they done in 2.5 minutes, or are they completed in 25 minutes? There's a big difference. So there is no doubt that the role of technology is very strong.
Because everybody hates paperwork. I don't think I've ever met someone that liked paperwork. So, and now we're speaking about digital technologies. When you started out in your career, did you see healthcare where it is today?
Oh, no. No. Some dreams came through.
Mm-hmm.
Yes. So, for example, first chronic disease management documents were handwritten, paper-based. Yes. So seeing the appearance of this new technology, this wonderful technology that does so many things,
Mm-hmm.
And supports evidence-based approach as well. Yes, supports decision making. Of course, to see that is one of the dreams that came through.
Yeah, that's really great. And just finally, if you didn't go down the line of work as a GP and practice manager, what would have been your dream job if you had any time again?
Oh gosh. A writer?
A writer?
Maybe a writer.
What would you write?
History.
History. I like that. Very good. Thank you very much.